Hey, Mr. Otten, good to see you again. And thank you for taking time to chat with us this afternoon. Could you tell us a little bit about your diabetes, your neuropathy, and this change in your diet?
Sure. Well, I started the plant-based diet towards the end of January, beginning of February. I was taking 130 units a day of insulin plus Jardians. Within 9 days of starting the diet, I was 100% off of the insulin, which means I didn't have to inject myself 5 to 6 times a day.
Wow.
I have peripheral artery disease. I've been in a wheelchair for spine issues, and as I got older, they got worse. I'm 75 years old now. Um, I noticed, probably 5 to 6 months after I started the plant-based diet, I was growing hair back on my legs again.
Wow.
Um,
Can I go back to the insulin? You said you're doing insulin, 130 units of insulin a day. You said within how many days were you off the insulin?
9,
9 days, because your
yeah,
sugars were dropping so low,
so fast.
so fast. Your primary care doctor said you needed to get off of it. Are your sugars better controlled now or when you were on the insulin?
They're a lot better. I don't get spikes anymore. I was getting spikes up mid 200s to 300s, and now most I've seen is like 155 to 160, and that's 2 hours after I eat, and then
Okay.
it drops down naturally.
Okay, very good. So within 9 days, you came off 130 units of insulin. You said you're not giving yourself an injection 5 to 6 times. You're saving money, you said, on that and some other medications you told me
Yeah,
that is
three to $800 every 3 months, depending if I'm in the donut hole or not,
sure, sure, sure.
which I probably will never get in the donut hole again now because they had me on two types of insulin and Jardiance, and I take none of it now.
Very good. And so tell us about your neuropathy, how bad that was, and how much better it's doing now.
Okay, I had neuropathy up above the ankle. Um, it was very painful. And then you would get these spasms of pain, and I could be like driving a car and it would be in my, right foot, accelerator foot, and it was awful. Sometimes I'd have to pull off on the side of the road to let it pass.
Hmm.
And I'd get it at night, but it's gone completely since I've been on the diet. I'm not sure exactly how long that took, but I think it was like 3 months, maybe four at the most.
And it's
Be-
completely gone.
It's gone completely. I
Okay.
don't, it used to feel like I was walking in sand. I don't feel that anymore.
Very good. Very good. You'd also mentioned with your peripheral vascular disease, after some time, you started noticing something different with your legs.
Yeah, they were starting to grow hair again. As
Interesting.
you can see, I'm a hairy guy, and to have bald legs, I mean, it all happened when they identified my peripheral artery disease.
Yes.
This was years ago. But part of that, also, I should say, when I was young, I had a tree fall right across my lower pelvis on both legs.
Okay.
And the doctor that I originally saw, Hobson, said that could have had some effect.
Okay.
But like an idiot, I smoked for years. So I got peripheral artery disease. So,
Gotcha. So that's gotten better on this
oh,
diet.
yeah.
And you had mentioned for the last 6 years, you've been in a wheelchair
Yeah.
related to a few different things that you'd mentioned, but tell me about what's transpired there.
Well, on August 20, I started feeling a lot better. I mean, like on the plant-based diet, I weighed 186, 87 pounds. I weigh 145 pounds now.
Wow.
Okay, so I did lose some weight that also, I assume, reduces pressure on my spine.
Hmm.
I also was told by you and Dr. Johnson that the plant-based diet should increase circulation in my spine,
Hmm.
and that I should have a increased mobility. So on August 20th, I got out of the chair and I haven't gotten back in it. It's been 65 days. I
Wow.
count every single day.
That's great. So you've been in a wheelchair 6 years.
Yes.
Last 65 days, you've not used a wheelchair. You've been
Nope.
walking, getting around. I remember
Yep.
you saying just like to get in a shower, it was hard to stand to get in a shower. So you're out of that wheelchair last 65 days. And you'd also mentioned something with your kidney disease.
Yes, I had stage 3 kidney disease. It appeared to be largely from the medications I was being prescribed, because as soon as I got off of the hydrochlorothiazide and the Jardiance and the insulin, I'm down to like stage 1 or stage 2. My kidney function is well in the normal range.
Great. That's fantastic.
Yeah, it's all the diet.
Yes. So any other thoughts here that you want to share with anybody on this plant-based diet? Has it been hard to do, easy to do, or any other comments?
Well, I love salads and I like vegetable soup. Mary makes one that is fantastic. Um, I went out and bought all the recipe books and what's that oven called? The pressure cooker.
Oh yeah, Instant Pot. Yes.
Yeah, I bought an Instapot. I don't have any problem with it because to begin with, I love salads. I love fruit. You can eat as much as you want all day long with salads and fruit. You are not going to get sick, you know?
Yeah.
So, for anybody who's having these problems, especially diabetics, you really need to get on the diet. It's not that hard. If you have circulation problems, you have to cut out the oil too. And that can be difficult because when you buy stuff at the store, if there's less than, what is it, half a gram or something of oil, they don't have to list it. So it's a little more difficult to do that. But I'm 75 years old and I'm walking. I walked up a hill today coming out of downtown Hendersonville. I couldn't do that for 10 years. It's well worth doing it. You got to give it a try, but you got to really try. You got to dedicate yourself to it. And it's cheaper than buying steaks and pork chops and all this stuff
Uh,
and processed foods like cold cuts. I mean, we shop in the vegetable aisle now. Pretty
nice.
much that's it. And the Ezekiel bread.
Ezekiel bread. Yes, yes,
You,
very good.
you
Okay,
have to
well,
watch the bread, but if you want to get well, do it.
give it a try. Well, thank you so much for sharing.
All right.